talking about changes to things, England's Plan B measures are to end from next Thursday, with mandatory face coverings in public places and COVID passports both dropped.
Well, the government has said, thanks to the success of the vaccination programme and dropping case numbers, people will be able to go to nightclubs without a vaccination passport, no longer have to wear a face mask in certain settings, and feel free, should you wish to return to office working.
Well, joining us now is Professor Azeem Majeed, Head of the Department of Primary Care and Public Health at Imperial College London. Firstly, then, does the data support this move by the government? What would your answer be on that one? Good morning.
Good morning, Anne. So I think the news is positive. We have seen a drop in cases in recent weeks, but case levels still remain very high at around 100,000 per day, which is much higher than we had in previous waves of infection. So I'd prefer some things to be kept in place, such as face masks. I think those are quite valuable. They're not very inconvenient for people. And I think it would be helpful to have that measure in place for at least for a few more weeks until we have more news about how cases would progress in the UK.
But we are in a situation, aren't we, where, although, as you quite rightly say, the infection rates are still, I mean, they're very, very high compared to what they were over the last 2 years. But obviously the hospital admission rate and the death rate is not comparable in the same way as it was initially, now that most of us are vaccinated.
That's correct,
does this
Stephen.
really matter?
Thanks to vaccines, we are seeing much better protection from serious illness. But around 1 in 3 adults have not yet had the booster jab, for example, so I think we need to push ahead with that further. In the longer term, if we want a normal society, that means people coming forwards for their vaccinations, including their boosters, as well as their first and second doses. So I think it's essential to keep on pushing vaccination, because eventually that's the way we'll lead a more normal life in the longer term.
I've heard, I mean, you're not the only doctor to be saying this, that why not stick with things like face masks for a bit longer until we're more sure? Why do you think the government has decided to go ahead and lift these restrictions now?
They've obviously seen the figures in terms of case numbers, which have dropped a lot from the end of December. I think also there's pressure with their own party as well to end these measures. So as Boris Johnson is under pressure from some of his MPs to scrap these measures and perhaps even scrap other measures as well, such as the isolation period we have for people who test positive. So I think there's pressure from his party, but I think as science suggests, we need a bit longer, probably maybe another month or so, and then review figures perhaps towards the end of February and see where we are then. So I think it's a mixture of politics and science, but I think politics is driving some of this change in the government.
OK, let's be clear on that then, because in effect what you're saying is if this is purely a political move, then you're saying, presumably, are you, that lives are being put at risk because of a political decision, because of someone wanting to stay in their job?
I think masks do help, but I think the government, the lives could be put at risk, perhaps not as many as before because we've now got good protection for vaccines. But I think we are seeing very high case numbers. We are seeing quite high death rates still, even though they have dropped from what we saw a year ago. So I think we still face a very tricky situation with COVID. We've got high case numbers, high numbers of admissions to hospitals, high numbers of deaths, and that will carry on probably for some time to come.
I wonder whether it's going to be difficult now if we take a personal decision, as I think I will, to go on wearing my mask. Will that put me in the minority? Will it actually be difficult to do that because people will make fun of you or even start shouting at you, as a man did to me the other day? Do you think it will actually make things more difficult for people who want to make that choice themselves?
I think it's easy when it's a government mandate to wear masks. When it's not a mandate and it's voluntary, as you mentioned, you will get people criticising for doing that. In my case, like with you, I will carry on wearing a mask. And for the time being, I wear a high-quality mask, which gives me more protection. So I would encourage people to carry on wearing masks for now until we have more data on how the pandemic is progressing across the UK over the next few weeks.
What do you make of this NHS vaccine mandate, the idea that the government may drop that within the next couple of weeks so people working within the NHS would not have to be vaccinated?
I think all health staff should be vaccinated. I'm fully vaccinated and I would encourage that. But I think in this case, I think government's probably right to review this and perhaps give people a bit more time to think about vaccination, because currently quite a large number of staff, perhaps 70,000, may lose their jobs in the next 2 months or so. So I think it's right to review this and perhaps give people more time to think about vaccination and perhaps encouraged by their colleagues to get vaccinated.
OK.
Yeah, well, thanks very much indeed for joining us. Wise words indeed. That's Professor Azeem Majeed, Head of the Department of Primary Care and Public Health at Imperial College London. Thanks very much indeed. Yeah, I was shouted at the other day for wearing my mask.
I mean, that's crazy, because actually people, you don't go shouting at people who haven't got a mask on, even when they should do.
I said it's my personal choice through my mask, and he went on shouting at me.
See, that's outrageous.
It is,
I do think it's outrageous. And I'm all for, as we talk about here on the channel a lot, we're all for people having different viewpoints. But it's about discussing them in a grown-up way, not yelling at people.
No, it was quite upsetting, actually.
I bet it was.
Yeah, horrible.